As well. So welcome everybody. Thank you for joining us tonight and welcome back to all of our regulars. First, we're excited to offer live transcription and captioning for our chats. You can click the live transcription button on your Zoom menu to turn that feature on or off if you're joining us on Zoom. Tonight we're going to start with a brief presentation from Liza, followed by a Q&A. You can submit a question at any point during the presentation. Please try to keep your questions brief to allow us to get to as many people as we can. We know you have a lot of questions. It's the beginning of the school year. To submit a question, just click the Q&A button on the menu on your screen. If you're joining us on Facebook Live, please submit your question as a comment under the live stream and we'll be taking your questions as well. If you see someone else's question that you'd like us to answer, please give it a like. The chat feature is going to be turned off for participants, but please keep an eye on the chat box in Zoom and the comment section on Facebook because we'll be sharing resources there throughout the presentation. So that's it for logistics, and I'll turn it over to our speaker, Liza.
Okay, hello everyone. Welcome. Thank you for tuning in tonight. We haven't seen you in a couple of months, and it's hard to believe that we're entering a second school year still in this pandemic. We know that this pandemic has had a tremendous impact on families, especially those of you who have children with disabilities or behavioral or mental health challenges. And I know, we all had hoped that this school year we'd be more clearly on the other side of the pandemic. And we know that that's not fully the case. With the Delta variant, there's still a lot of anxiety and uncertainty. And at the same time, many of us feel like our kids kind of need to get back on track and in some cases need to make up for losses. So tonight I'm going to be briefly covering the health and safety requirements for this school year. Then I will be focusing on mental health and wellness of students as they transition back to school. And I'll be going over some of the guidance that's been put out by the State Department of Education. The Department of Elementary and Secondary Education has provided guidance to school districts as we enter this school year regarding social, emotional, and mental health supports. So, and at the end, I'll be briefly touching on compensatory services as well, because I know that that's an issue that's an important topic for many of you. And then followed by question and answers. From this point forward, I'm going to use the acronym or shorthand DESE to refer to the State Department of Education. So when you hear the term DESE, that's what I'm referring to. So first, before we get started, we wanted to announce that today was the release of our new MAC report. Called A Pivotal Moment, Ensuring an Equitable COVID-19 Recovery in Massachusetts Schools. So really excited about the release of this report. Again, it was just released today, so this is hot off the press for all of you to see. The report was developed in collaboration with a group of experts in education and includes very specific recommendations and detailed recommendations on how to address equity during the pandemic and recovery period, specifically for students of color, students with disabilities, English learners, and students with mental health and behavioral challenges. So we really encourage you to check it out. It's available on our website, and we also will be posting and sharing these slides tomorrow, which will contain the link right here in this slide to the report. So health and safety requirements for this coming school year, as many of you I'm sure know at this point, schools are required to be full-time, in person, 5 days a week. Masks are required for all staff and for students ages 5 and up. This decision will be reevaluated by DESE on October 1st, based on the available public health data at that time. Also on October 1st, the mask mandate will be lifted for vaccinated middle schoolers and high school students. There are no physical distancing requirements this school year. The department has been heavily emphasizing vaccination and has even made available mobile on-site vaccination clinics if needed and requested by school districts. And DESE has also made available diagnostic and weekly pooled COVID-19 testing, and they're really encouraging school districts to take advantage of those options. There's also this year a new test and stay option, which is specifically for students who've been have been determined to be in close contact with someone diagnosed with COVID. If that close contact, that student who's a close contact is also asymptomatic, they may choose to remain in school as opposed to quarantining at home. But those students must be tested daily, and they must be masking at all times. That is a new program, though, to be aware of. If a student is symptomatic or has tested positive for COVID-19, they must comply with the quarantine requirements. As always, disabilities must be accommodated. So if a student is unable to wear a mask because of their disability, and that disability is documented, then that disability must be accommodated. Depending on the disability, the school district may be able to support and work with the student to learn and gain the skills or to become more comfortable wearing a mask. But in the meantime, if the student isn't fully able to wear a mask because of their disability, then again, they must be accommodated. A doctor's note is not required in order for the school district to make this accommodation, but we recommend if your child cannot wear a mask due to their disability or due to a medical condition, we do recommend getting a letter from a doctor or from a provider such as an ABA therapist or mental health provider, because it will be more helpful. We think it will be helpful for the school district to have that information about why your child is unable to wear a mask or unable to wear a mask at all times, and probably will be more successful in obtaining that accommodation. Also, something that's really important to know about is home or hospital services. So this is if your child is unable to attend school in person and needs to continue to learn at home, or if they need to learn in a hospital setting, and there are legitimate medical reasons that they need to continue to be at home or in a hospital, then the family can submit a home hospital form, which is completed by the student's personal physician, which can include a nurse practitioner, psychiatrist, etc. And the form must state the medical reasons that the student must be at home or in the hospital for a minimum of 14 days. And then the school, once that form is submitted, the school must provide educational services in that setting, either the home or hospital. And in addition, those educational services are just regular education services such as tutoring, or it might be online remote learning that they're offering, so the student can actually log into their own classroom, for example. And then in addition to that, if the student has a disability and is on an IEP, then the IEP services must also be implemented. So here we have a link to the home hospital physician form, which when we send out these slides, you'll be able to access that. So that's the form that the doctor needs to sign and that the family needs to submit to the school if your child is not able to return in person due to a medical condition or disability.
Hey, Liza, I'm sorry to interrupt you. It sounds like there's some shuffling or something rubbing up against the microphone, maybe.
Oh, okay. Yeah, I think it might be my paper. Is that better at all?
Yeah, I don't hear it now. Thanks.
So just shifting gears to the children's mental health crisis. The pandemic, we know, has been hard on everyone's mental health, but there's been evidence to suggest that it's been particularly hard on kids. And given the social isolation, the limits of remote learning, the stress on families, there's been data to show the real impact on kids. Nationally, according to the CDC, ER visits for children related to mental health are up 40%. And that's between March and October 2020, as compared to that same period the prior year in 2019 before the pandemic. And also Boston Children's Hospital reported 270 admissions for suicidality between July and October 2020. And that was a 40% increase from the same period the prior year before the pandemic. And I think it's important to acknowledge that actually the mental health crisis for children existed prior to the pandemic. There's been in Massachusetts and also nationally, but just speaking specifically to Massachusetts, there's been a longstanding lack of adequate pediatric therapists, outpatient mental health services, and inpatient psychiatric beds. So even prior to the pandemic, there were long wait lists for children's mental health services, and children were actually boarding in the emergency room and in other hospital inpatient settings waiting for available mental health beds. So this has been a crisis for a long time, but it's only exacerbated during the pandemic. So what is DESE's role? What is the role of schools as regards mental health and social emotional learning? Well, the State Department of Education, DESE, has issued guidance strongly emphasizing the importance of supporting students' social and emotional health and mental health as they transition back to school this fall. It's been a major priority of DESE, and they've been really emphasizing with school districts that the social and emotional needs and mental health should be a priority. So that's something that school districts should be aware of, and parents can emphasize to school districts. This DESE has issued guidance entitled Promoting Student Engagement, Wellbeing, and Safety. This was a guidance document that was previously issued last winter, but has been updated and then was reissued this past summer for this school year. And this version of the guidance is very strong in terms of making very clear to school districts that they are to encourage positive behavior by creating safe and supportive school climates, by working closely together with families, partnering with families, and moving significantly away from more punitive approaches to responding to behavioral and mental health challenges. So the guidance is really strong on that point. There's really helpful language in the guidance. You as parents and advocates can certainly pull up this guidance and quote it and reference it when you're advocating on behalf of your child, particularly if they're having behavioral or mental health issues. But as I said, a huge emphasis on strong two-way communication with families that's culturally and linguistically appropriate. That communication cannot be, the importance of that communication cannot be overstated. Parents always are the experts in their child and what their child needs. And then that's particularly true now because of the pandemic. Parents know their children's needs really better than anyone. And in many cases, they may know better than the educators because they've been with their children for greater periods of time. So it's really, really critical that school districts are reaching out to parents, communicating, asking about their needs, and keeping that strong communication open both ways. And if school districts aren't reaching out to you, I really encourage you to be reaching out to your contacts at the school district. This guidance also recommends relationship mapping, which is a strategy which ensures that every student has a positive relationship with at least one adult in the school building. That's another research has shown that can be very effective and very protective for students against mental health challenges. So that's another strategy that's been recommended by DESE to school districts that you can be looking for in your child's school. Again, encouraging schools to establish safe and supportive cultures, supporting positive behaviors, implementing things like practices such as restorative justice practices. And finally, the guidance makes very clear that exclusionary discipline should be used only as a measure of last resort. And the guidance specifically says that before resorting to suspension or expulsion, alternatives to suspension must have been tried. And exclusion should only be used after the school district has considered the reasons for the student's behavior and has made efforts to address the student's underlying needs. So this is really to acknowledge that the DESE, State Department of Ed, is acknowledging that students have been exposed to significant disruption in their schooling, to trauma in some cases, to lots of stressors, and may have increased behavioral challenges and mental health challenges as a result. And that punitive and exclusionary discipline in response to those mental health and behavioral challenges is not going to be productive. I think the department recognizes that further excluding students from school after they've been out of school for such a long period of time in many cases is not really a productive solution. So that's something that it's good for parents to be aware of, that really is the emphasis at this point, is to be moving away from those practices and toward, positive mental health supports and other kinds of positive supports. So the guidance, just continuing on that point, it encourages school districts to identify signs of trauma and use strategies to address trauma. It encourages school districts to use mental health screening tools and to implement a range of evidence-based supports for students. A few examples contained in the guidance from DESE. Check-ins and check-outs. So some students do really well if they have, for example, with that adult figure with whom they have a positive relationship, if that adult checks in with them at the beginning and the end of the school day, that can be very helpful and very protective for them. Another strategy that was suggested is collecting self-regulation strategies for a student to have, on their desk for them to be able to access. The implementation of positive reinforcement plans, teacher coaching, so mental health staff in school, social workers and counselors can work more not only with individual students, but also work to train and consult with and support teachers so that teachers better understand the mental health needs of their students. And then finally, DESE encouraged districts to implement school or district crisis teams to respond to mental health crises. So in terms of if your child has a disability and is on an IEP and your child is having increased behavioral challenges since the pandemic, or you're worried about their mental health, there are a few different things that you can do. One is you could request a functional behavioral assessment, or FBA. And the purpose of a functional behavioral assessment is, it's basically what it sounds like. It's to determine what is the function of the behavior that's arising. So what is it that is leading to the behavior, and what is the function of the behavior? Is it for attention? Is it due to avoidance, or some other function? And then an FBA typically makes recommendations to be implemented in a behavioral intervention plan. And that can be a very helpful document for a child with a disability who does have behavioral challenges, because then the school district is required to implement certain strategies in response to behaviors instead of resorting to punitive or other kinds of practices that are less helpful. You can also request a special education reevaluation if you believe that your child, even if your child already has an IEP, has a disability, has an IEP, but if you believe that your child may have a new disability or a need in an area of a new disability, like a mental health disability, anxiety, depression, etc., then it may be appropriate to request a reevaluation. School districts must conduct reevaluations every 3 years, but parents can request them as frequently as every year. So that's another possibility. And then, of course, you can always obtain an independent or private evaluation if you're concerned about your child's behavioral or mental health needs and you want more information and recommendations from an expert, which you can then share with the school. So shifting gears to compensatory services. I know this is on a lot of parents' minds right now, because a lot of parents who we've been speaking with, their child who has a disability may have been receiving remote services over the past year and a half, but their child, wasn't receiving all services on their IEP, or maybe the school district was attempting to provide all the services on the IEP, but the student just really was not able to access them because of their disability. And so COVID-19 compensatory services are owed if the services were either not delivered or the student was unable to access those services. And assuming that the student had lack of progress as a result, or even regression of skills. So the most important thing to know here is that IEP teams should be convening at the beginning of this school year to determine the need for compensatory services. And that could be to determine compensatory services arising from last school year or even from the year before, the spring of 2020, potentially, if the school district still has not addressed the need for compensatory services stemming from that far back, which hopefully they already have addressed that. But if not, we'd really encourage you to raise the need for those services. School districts should be initiating these team meetings to talk about this, but if they're not, we encourage you as parents and advocates to go ahead and request those IEP team meetings to discuss the need for compensatory services. The other thing that I think is important to note is that it doesn't have to be a special team meeting to discuss compensatory services. It can be, you can request that meeting, but also if your child has an annual review team meeting or any other team meeting that's scheduled, you can raise compensatory services in that meeting as well. So we encourage you to do that because we know that many kids, even if school districts were doing their best to deliver services remotely, we know that many kids with disabilities were just not able to fully access those services and may have been losing ground in terms of their skills or just not progressing. And if that's the case, definitely reach out to your school about compensatory services. DESE has issued guidance saying that in particular, schools should convene IEP teams for to discuss the need for compensatory services for the following groups of students. If the school district was fully remote for 3 or more months, if your child was chronically absent last school year, or if your child had significant difficulty accessing remote learning due to either their disability, technology barriers, language access barriers, or other barriers related to the pandemic. So if your child falls into any of those 3 categories, then districts have been given guidance that they should basically be prioritizing those students for the scheduling of team meetings to discuss the need for compensatory services. But even if your child doesn't fall into one of those categories, again, if you think that they're owed, that they should be receiving compensatory services, then I would encourage you to go ahead and reach out to the special education team. So what else can you do? In general, we always encourage parents to start, collaboratively working with the school district, working with whoever your point person is, talking with the teacher, if it's the ETF or special education coordinator, whoever your contact person is, to start communications with that person and see how far you can get. Request a team meeting, speak with the team, try to go that route. If you're not getting anywhere, you can always email the principal, you can email the special education director or superintendent. And then of course, if you really feel that the district is violating the law and not providing your child with services to which they're legally entitled, you can file a complaint. The PRS complaint system, which refers to the problem resolution system. Again, it's through the State Department of Education. We have the link right there. It's a very accessible complaint system for parents. It's a very simple form to complete. You can complete and submit it online. And if you feel, for example, that the school district is not delivering compensatory services and your child is owed compensatory services and you've tried discussing with the school and they're either not convening a meeting or refusing to provide compensatory services that you believe your child is entitled to, then you could go ahead and file a PRS complaint. There's also the BSEA mediation and BSEA hearing process for special education matters. And as always, we encourage you to contact our helpline if you have questions about your individual case and just need some assistance. We can help walk you through what the next steps might be in your particular case. So with that, I think we will open it up to questions.
Great, thank you so much. And we do have some questions, and I encourage you all to keep those coming in the Q&A box there on Zoom, or you can submit a question on Facebook in the comment section, and we'll take your questions from there as well. So first up, we have a couple of questions about the home hospital services. So this one is our district is saying that because the state says remote learning doesn't account for learning time, my kids can't connect remotely. But you said that home services can look like tutoring, special education services, and possibly connecting remotely. So I'm getting mixed messages. Also, in their IEPs and in the past, my kids have been able to connect via video during periods of extended absences. So I don't understand why the school is now saying no video streaming.
Mhm. That's a really good question. I'm really glad you asked that. So, DESE has made it very clear that remote learning as an educational model is not supposed to be offered this year. That all schools must be full-time, in person, 5 days a week. That there is no hybrid learning. There's no option for families to have remote learning. But there is this one exception, and this exception is home and hospital services. And so that is if your child has a documented medical condition, which, and for some reason they are not able to attend school in person because of that medical condition or disability, and a doctor is able to attest to that, and that they have to be home for more than 14 days, then the school district must legally accommodate that, and they must provide education services. And those education services, as I mentioned, and as you mentioned in your question, can take the form of tutoring. It can take the form of remote learning. Remote learning is not a standard option that's offered to any family. You can't request remote learning because you would prefer it, or your child would prefer it, or it's just more convenient. It's not a standard option that's being offered by any district. But if it's needed due to a documented medical condition and a doctor has attested to that, then yes, then the district must comply with that, and they must provide educational services. And I would say that remote learning in that context actually might be the best option, because then they can access their actual classroom and have as close to a real classroom experience as possible. So in that kind of narrow context, remote learning can still be used by school districts and can be really helpful to students. But again, it's not an option the parents can just select or students can select. It's something that has to be documented by this home hospital form and submitted to the district.
Thank you. This one is also about home hospital services. My daughter's school didn't have a nurse for my daughter to attend until September 13th. They refused to teach her remotely for 2 weeks, citing the teachers' union contract, which said no remote teaching. My daughter has had a physician home hospital form every year since she started school. Her school said they would add on to the end of the COVID compensatory extended transition year she's currently in. She was supposed to be back into this COVID compensatory services program in April, but has been home doing remote learning until September when it stopped. So what can this person do?
Okay, I'm not sure I'm totally following all of the later facts in there, but it sounds like the student does have a current home hospital form completed. That would be the first question I would have, is if there's a current home hospital form which has been submitted, which has been signed by a doctor or other qualified medical provider, which states that your daughter does need to be home receiving educational services at home due to her disability or medical condition. If that's the case and that form has been completed, the school district must comply with that and must deliver those services to your daughter. And if they're not, I would say that they're out of compliance, and that may be a good instance in which to file a PRS complaint. So, but it's so fact specific that I would really suggest calling our helpline so that we can talk you through some of the details.
Thank you. And I'll post that helpline information in the chat again. We have a couple of people with this question. What if your child received services, but there was no progress? He didn't receive help to catch up, but it was continuing OT, ELA, and math classes. He didn't make any progress. What are my options?
So was it clear from the question if this was during the pandemic, during remote learning?
I think so.
Yeah. So it sounds to me like Just to reiterate, COVID-19 compensatory services and compensatory services in general, even prior to the pandemic, are warranted if if services on your child's IEP were not delivered, or if they were delivered, but your child really couldn't access them. And if your child either didn't make progress or regressed in their skills. So it sounds to me from this fact pattern that the services may have been
They were
delivered, but
the
the
summer.
student didn't make progress. And
Summer.
so is that your understanding, Lilia?
Yeah, he said there were services in the summer.
Yeah, so services in the summer required by the IEP that were delivered, but the child didn't make progress. So the question I would have then is if they were remote services. If they were remote services, then there's a question about whether your child is really accessing the service. So if the school was delivering OT through the computer and your child was, you were trying to get your child to focus, but they were running around the house and not really focusing, or just not able to access the service in some way, then and they didn't make progress as you stated, then I would say that there's a strong case for compensatory services. If it was an in-person summer program, that's a little bit different. You could try to make the argument that they couldn't access the service for some reason, but you would need to have some kind of reason that they weren't able to access the service. Or if there was a service that just wasn't delivered over the summer, but you would have to be able to show that there was some kind of missed service that your child didn't receive over the summer or couldn't access, and that's the reason that they didn't make progress.
Thank you. Next question. If a child cannot wear a mask, looks more like they will not wear a mask, and they remove their mask during the day as a behavior, can the student be required to leave the classroom because they remove the mask?
So no, DESE has provided guidance on this. Students should not be separated because they're not able to wear a mask. And I think that it's a good question, because oftentimes, and I like the way this question was framed, because oftentimes school districts will frame it as a willful, act of noncompliance on the part of the student. But if a student is kind of repeatedly taking off their mask, there's almost always a reason for that. And I think school districts have been encouraged and really required to look into what is the reason that they're not wearing their mask, and then they need to, if it's a disability related reason, they need to accommodate that. And of course, school districts should be working with students to try to comply with the mask mandate and encourage them to wear the mask. And if they're a student with a disability, they can work with them on that skill, but they should not be punished for not wearing a mask or separated for not wearing a mask. And there has been previous guidance from DESE on that. So as a parent, I would just encourage you to communicate with the school around this. If you have an understanding about why your child is not wearing the mask, I would really encourage you to communicate with the school district. If your child is on an IEP, convene the team meeting and discuss it. And just make sure that the school district understands that they must be accommodating your child's disability. And then the last thing I would suggest is, again, depending on the situation, but in some situations, it may be appropriate to get a letter from an outside provider, such as a doctor or even a mental health provider, ABA therapist, basically explaining why the child is having challenges keeping the mask on, so that the school district doesn't continue to interpret it as some kind of willful non-compliance.
Good question. Next question. Can you give an example of how to use this mental health language that you were using? They just reference us to a hotline in our district.
Okay. Yeah, I'm not sure about the hotline that you're referred to. Maybe it was a hotline for mental health services, which is interesting. School districts are required to address disabilities of students and are required to evaluate students for all types of disabilities, including mental health related disabilities. So if your child is having mental health challenges, which are really interfering with their ability to make progress in school, it may be that they should receive special education services, and special education services are not limited to academics. It can include social and emotional and behavioral needs. So that's one thing that I would say. And then more broadly than that, even if your child doesn't have a disability and you don't think they meet the threshold for having a disability, like they're still really able to function well at school, but maybe they're just a little stressed out. Then I think, in either case, I think that parents and advocates can be referencing the promoting student engagement guidance, which I described in my presentation, because the guidance, it's quite long actually, but it contains a lot of really good language about and resources that school districts should be using in order to support students with behavioral challenges. It references positive behavioral supports. It references the relationship mapping, relationship with a trusted adult that I mentioned. It references the contact at the beginning and the end of the school day, which I mentioned. So all of those, any of those things, if those are things that you think your child might benefit from, you could quote that part of the guidance and say, I've read this guidance from the State Department of Education. It says the school district should be using these strategies. I think this strategy would really help my child because they're struggling in X, Y, and Z way. And I'm requesting, that the school district find a way to implement this. So that's an example of how I might use that guidance. If you think your child would benefit from anything that's in there, you can quote it and use it either in a meeting. Use it appropriately based on your relationship with the staff persons at your school, at your child's school. But you could quote it in a meeting, or you could, even in an email, potentially, if you feel like the school district is not being responsive, you could include some language. And it would just show that as a parent or as an advocate, like you really know what you're talking about, because you're quoting the latest, guidance from the State Department of Education. And it should make the district really pay attention to what they're doing and prioritize the kinds of needs that you're raising. Good question. These are all really good questions. Excellent questions.
We're getting a lot of really good ones coming in. I'm going to stop the screen share just so we can see better. There we go. Our next question. I emailed the school about compensatory services in the end of July, and I emailed again and was told that the request was sent to the team chair and to the special education chairperson. How long do I have to wait?
Yeah, so that's interesting because it was during the summer months, and oftentimes, not all the school staff are even working over the summer. So I would wait. Now the school year has started. I would give it, maybe just a week, and then I would recirculate the request at that point and just say, not just in a way to check in and ask, to check in on the status of the request. Say, I sent this over the summer, but I know that not all staff were working over the summer, so I wanted to check in again on this request. I believe it's really important for the IEP team to convene as soon as possible to address these needs for my child. And I'm wondering if we can schedule a team meeting this month, or say, something very specific like that, giving a time frame, but being friendly and collaborative. And not kind of blaming them, but really just reminding them that this is an important request. It's now the beginning of the school year. We know all the staff are back, and kind of putting it back on their desk, front and center to address at this point in time. And then if they continue, like if weeks pass, now it's the start of the school year, weeks pass, it's now October and they still haven't responded to your request. At that point, I would, continue to kind of go up the chain. You can contact the principal, the special ed director, the superintendent, as I discussed before, and then, ultimately you could file a PRS complaint.
Thank you. We also have some template emails on our website to help get that conversation started with the school. So I put a link to that in the chat as well. Can you give some examples of compensatory services for a child with an existing IEP? Yeah, so if a child with an existing IEP had
speech therapy services 2 times 30 a week. And during last school year, the school district was remote for 3 months, and the school district attempted to deliver those speech therapy services, but maybe they only delivered them once a week because, the speech therapist wasn't available or couldn't cover all the needs of the students in the district. So for a period of 3 months, the student was receiving 1 time a week of speech therapy as opposed to 2 times a week. Then you could calculate all of those missed sessions over that 3-month period, and you could request compensatory services to make up for those missed sessions. I will note, just as a caveat, compensatory services are not always a one-to-one, meaning that if your child missed 30 sessions of speech therapy, it doesn't necessarily mean that the district is required to make up 30 sessions of speech therapy. What the district is required to do is to make your child whole based on what they missed and their lack of progress or their regression. So it may be that and oftentimes school districts will agree to a one-to-one, but sometimes it's not as clear cut as that. If, for example, a student didn't receive just social skills instruction or something that just wasn't as clear cut, sometimes you can't really calculate it in such a clear way. And those are the cases. I think what I would recommend for parents and for advocates working with parents is to, yes, calculate what services were missed or what services your child couldn't access, but then also spend some time thinking about, okay, as a result of this loss, as a result of this missed service, my child is really struggling in X, Y, and Z ways. And this is what I think he or she needs in order to be made whole. For you to think creatively as a child's parent about what you think your child needs in order to get back to where they were, or in order to, make more progress. And I think based on thinking that through, that could be your proposal to the school district. You could say, you could say something really basic like, yes, I think my child needs 30 sessions of speech therapy because she missed 30 sessions of speech therapy. That's very straightforward. Or you could say, I think my child should have a special, summer program in 2022 related to social skills instruction because they missed, X amount of social skills instruction during the school year. I mean, you can come up with more creative proposals like that. And I really encourage you to just think about what would your child need to be made whole, and then to advocate for that with the district.
As a follow-up to that, is there a limit on the amount of compensatory services that a student can receive?
There's no set in stone limit. It's all based on the individual needs of your child. So just like the IEP is completely individualized and based on the needs of your child, it's the same with compensatory services. So it's based on how many services they missed or were not able to access, and then it's based on how much they've lost in terms of skills and where they're at in terms of their current skills and what they need to be made whole. Again, that's really the standard. What do they need to be made whole to be put back in the position that they were, before the loss? So that is what I would recommend advocating for. And no, there's not a set limit, but it does have to be based in what the student didn't receive or wasn't able to access.
You kind of answered this already, but can you just clarify who decides and how it's decided that a student has been made whole? What do you mean by that?
So the compensatory services determination is the State Department of Education, DESE, has provided guidance stating that the IEP teams should be making these decisions about what compensatory services your child is owed. That said, there's also been guidance stating that it doesn't have to be the IEP team, that compensatory services can be kind of negotiated and arrived at just through a dialogue with the school district. So we're kind of encouraging parents to go the IEP team process, because it's a simple step you can take, is just to request a team meeting and sit down and talk about compensatory services. But if you don't think that will work for you, another option is you could just work with an administrator in the school, with someone with whom you have a relationship with. If it's, I don't know if it's the special ed team chair or the principal, but you can come to an agreement for compensatory services just through direct negotiations with the school district. So that is another option. It really depends on the dynamics with your child's school and your relationships. I think oftentimes the route that makes sense is to convene the IEP team meeting, but it may not make sense in all cases. And if a family has an attorney, oftentimes compensatory service settlement agreements are arrived at, through negotiations between the attorneys. So there's lots of ways that the decisions can be made. But ultimately, the school district either is or is not going to offer compensatory services. And if you as the parent disagree with what the school district has offered, or if the school district has not offered anything and you believe your child is entitled to compensatory services, that's the point at which you would take advantage of the dispute resolution processes, such as PRS or the Bureau of Special Education Appeals mediation or hearing process.
And we have a newly updated resource on our website with some letters of finding from PRS complaints that have been made. So I can put a link to that in the chat. That might be helpful if you are making a complaint.
And Lily, I know it's about 8:45 and I'm able to stay on until 9 to answer any other questions that you all might have. But do we want to put up just the closing poll at this point?
Great. Thank you.
So this is just the final evaluation poll. For those of you who do have to sign off, and for others of you, I'm happy to stay on a few more minutes to continue answering questions.
Great. This is a really good question. Hi, I'm noticing a lot of challenging behaviors back to school in person. My son's getting agitated easily with denied access. Can you give some recommendations on how to identify mental health challenges and what could be handling or coping strategies? My child's an 11-year-old nonverbal student with autism. What are some positive behavioral support or self-regulation strategies that I can use?
That is a really good question. And I'm an attorney, so I'm not going to probably be able to provide, all of the strategies that a behaviorist or a psychologist would be able to provide. So I'll just start with the perspective, the attorney perspective, which is that I think you should look at your child's IEP, see what services they're currently being provided, and then think about whether you think there are additional services that your child needs that he or she is not receiving. If you think that's the case, there's a few different avenues that you could go. You could request, and I mentioned this earlier in the presentation, but you could request a functional behavioral assessment from the school district, which would be an evaluation that the school district would conduct about the behaviors that are presenting, trying to determine why your child is presenting with those behaviors. What is the function of the behaviors, looking at what they call the antecedent, what happens before the behavior, and then the consequence, what's happening after the behavior. And it's a very detailed kind of observation of the child. And then a report with recommendations about what interventions and positive behavioral supports your child needs. And usually there's a behavioral intervention plan that comes out of that functional behavioral assessment. And that behavioral intervention plan, if your child doesn't already have one, it sounds like they may need one. And the way to get to that behavioral intervention plan is to request a functional behavioral assessment. So and this is all just kind of from an advocacy perspective, that's one step that I would recommend considering. I think I mentioned this earlier as well, but you could also obtain an evaluation outside of school because of the new or increased behaviors that are presenting, and then present that evaluation. If the evaluation has recommendations which you believe are useful, you could present that to the school, to the IEP team. They have to, once you provide the report, they have to convene within 10 school days to consider that report. And then you could advocate, in that meeting for whatever the recommendations are in that outside report. So those are some of the advocacy strategies that I would suggest in terms of like what specific positive behavioral supports would be best for your child. That's hard for me to answer without knowing more about your child. And again, being an attorney rather than a behaviorist or a psychologist. But I think what I would recommend is definitely positive behavioral support plan, behavioral intervention plan if your child doesn't have it. Any kinds of all supports should be positive as opposed to punitive. I would certainly recommend that. And then just it should be based on your child's needs and what you believe and what the school determines is leading to the behavioral challenges. And it should be really specifically individualized and catered to those challenges. Some kids with autism need sensory breaks. And just need to go for breaks, so for walks in the school, or need to take breaks and jump on the trampoline. Other students, it's really the behavioral challenges are stemming from communication challenges. So if they're not able to communicate what their needs are, then it may be that your child, needs an AAC, augmentative alternative communication device, or if they already have an AAC device, that may need to be further examined. So is it a communication challenge? Is it a sensory challenge? Is it some other kind of behavioral challenge? So there's lots of different routes you can go with it. But again, I think two advocacy tools, requesting the functional behavioral assessment from the school or getting an outside evaluation to make recommendations around what your child specifically needs.
So many good questions here.
Yeah, these are really good. Yeah, keep them coming.
We've got a lot. And please, please, please call our helpline if we're not able to get to your question tonight. Next question. What is the district's obligation when a therapeutic school placement has been made and implemented and your child is refusing to go to the therapeutic school? What's the district's obligation?
Yeah, so I would say that the district's obligation is to evaluate the reasons that your child is refusing to go to that placement. So there obviously is a reason that the student is refusing to go. I know that this school year we're anticipating, much higher rates of what's called in the field school avoidance or school refusal, which is oftentimes related to anxiety. When a student is really anxious and nervous about going back to school. I mean, especially for students who've been out of school for a long period of time or who had a lot of disruption in schooling and have underlying disabilities, it can be, very, very challenging and very anxiety producing for them to be transitioning back into school buildings right now. So I believe that it's a school district's responsibility to assess, and that may include, a home assessment, or other kinds of assessments to really get to the bottom of why the child is refusing to go to the placement. And then once they've done those assessments, to reconvene the team to determine, again, to evaluate if that's an appropriate placement, if there may be a more appropriate placement, and to otherwise address whatever the barriers are for that student and whatever the student's disability related needs are that are preventing them from getting to school. And then the school district needs to meet those needs so that the student is able to access their education and get to school. That's what I would say.
Thank you. In regards to promoting to the next grade, I feel my child is not ready at all for the current grade and will like for him to have not gone forward from second to third grade. I did ask the former teacher about retaining him, and I was told keeping them back was not an option, and it's very hard for the teacher to support this, usually not helpful, although they agreed with me. Any options for me to challenge this? He does have an IEP.
Yeah, that's a good question. I mean, it sounds like you're kind of doing what I would recommend. I know that as a statewide policy, the State Department of Ed has basically indicated that they don't think that retention is going to be a good option for most students because there has been a lot of research that basically says that retention does not lead to positive outcomes for kids. So I think in general, as like a policy matter, you're going to see school districts and the state leaning against implementing retention-based solutions. That said, it really is an individual case-by-case decision. And it sounds like in your child's case, it may be appropriate, especially if you feel it's appropriate and the teacher feels it's appropriate. And if that's the case, if both you and the teacher feel it's appropriate, then to me, I'm not sure what the problem is. Maybe something to discuss with the principal to find out what the barrier is, if it's something that it seems like everyone is in agreement about. Yeah, I would just continue to kind of work up the chain of leadership to try to continue to push the issue if you do really feel strongly, if the teacher agrees. And it may also be helpful to have, an outside opinion as well. I don't know if you have an evaluator that you've worked with, like a neuropsychologist, but it may be helpful, or even your child's pediatrician or other providers who really know your child, for them to weigh in on this issue as well, and maybe write a letter or provide a report or a summary explaining, why this is really needed for your child. That also could be helpful to inform the school district of why this may be the best thing to do.
Okay. Another interesting question. Can parents request for accommodations or goals in the IEP specifically around extracurricular activities if the student has disabilities that impact them socially? Social opportunities in school were very limited during COVID.
Yes, so I would say definitely yes. There is a page on the IEP in which there are check boxes where the school district has to indicate what academic or learning areas are impacted by your child's disabilities. And it's, there are check boxes for communication and behavior and communication skills. But there are also two check boxes, one for non-academic needs and extracurricular needs. And so I would check, I believe it's PLEP A. It's anyway, without getting into the technicalities of the IEP, look for the page that addresses accommodations, that has those check boxes. It's at the top of the page, and see if extracurricular activities are checked. And if not, then you can request or reject the IEP in part, requesting for that box to be checked. And then I would suggest raising it, in the next IEP meeting. And certainly social skills, are just critical for school districts to be addressing, particularly on the heels of the pandemic and students being out of schools. Those skills are going to be really, really important and should be incorporated throughout the IEP, both in terms of goals and objectives and also in terms of accommodations. And then I think this question is a really good one. It's alluding to the fact that that social skills instruction should also apply to non-academic activities like an unstructured time, lunch, recess, etc., and also extracurricular activities. Good questions, all excellent questions.
So we have time for maybe two more questions. This first one is, my child does not like anything in their nose. I asked about the testing for COVID, if instead of the nose swab, could they use a mouth swab, and they're not giving me an answer. Is there anything I can do?
That's a great question. That's one I have not heard before, but certainly I think it's a reasonable thing to ask about. I've not heard of any COVID-19 tests that aren't either the nose swab or the nasal cavity test, but that's not to say they don't exist. So I would, yeah, I'm not sure what I could say other than what you're already doing, which is to ask the question and to, just continue to push to say this is an accommodation that your child needs, that they have, a specific anxiety around the swab in the nose. If it is like a really significant fear, I think if it's just something that's not that big a deal, it's a little bit uncomfortable for them, that's one thing. If it's a really significant like phobia, it may be something where it could be helpful to get a note from an outside provider, like a therapist or a mental health provider or a primary care physician, just kind of explaining, because that may prompt the district to take it more seriously, and then look into other options. The question I don't know the answer to is what other options are available. So that's something that it's also something that you could do some independent research into or talk to your child's pediatrician about, and then bring that information back to the school.
All right. And our final question. My son started kindergarten today. Congratulations. Happy first day of school. He's on an IEP, and the district have decided to change him from the school. They took him out from a full services school to a school with less services. Today, when the bus came to pick him up, he was the only child on the van. I was very worried that whether the school will be able to provide enough support for him. If I don't see benefits for my son, can I ask them to change his school?
Yeah, so that's a great question. I guess my first question would be whether the placement on your child's IEP was actually changed. So if you look at your child's IEP, if you look at the placement page, which is usually toward the end, you'll be able to see what your child's placement is. And that's like full inclusion, partial inclusion, substantially separate setting, et cetera. And you should look at your the current IEP, look at the placement page, and then look at the prior IEP and the placement page. And if the placement has changed and you didn't consent to that change of placement, then that's an issue and that's unlawful. And you can, immediately bring that to the school district's attention, and you have the right to stay put to the prior placement, which means your child should continue to have the prior placement until there is a decision that you've agreed to for a new placement. If it's that the placement has been the same from the prior IEP to the current IEP, but the school district changed the school, that's a little bit more complicated legally. But I think that there's still an argument that the school district changed the specific placement and the location, which includes the actual school, the location, potentially without your consent. So again, but it's really going to depend on some of the details around the IP, what the placement is, what the school is, and what services are or not being provided, and what you accepted and didn't. So what I would recommend with this one, because it is so fact specific, is definitely call our helpline, and we can help walk you through it.
All right, thank you. So that's it for questions. If we weren't able to get to your question, please do contact our helpline. I put that in the chat. Again, it's 617-357-8431. When you log out, you'll be directed to a survey to share your experience with these chats. We really want to tailor them to your needs, so please fill that out. If you've already filled it out, thank you. There's no need to do it again. And if you have any feedback or ideas for chat topics that you'd like to share with us, you can also share those here in the Q&A.
And just wanted to say thank you to everyone. Excellent questions, and wishing you all the best of luck with this upcoming school year. We know it's really challenging, and we know that you all are just doing an amazing job, advocating for your children. So best of luck, and thanks so much for joining tonight.